Welcome to this EI Medical Imaging presentation on equine fetal sexing. Fetal sexing provides valuable information for owners and breeders and aids in decision-making about which broodmares to keep and which to sell. There is the potential for higher sale prices with a known fetal sex. Most analyses show colts bringing significantly more, but this of course can differ depending upon the intended use and pedigree of the foal, for example, breeding stock versus performance, as well as the age of the mare and whether she will continue to be bred. Knowing the sex of the foal can also help owners to estimate cash flow, make insurance and financial decisions, plan for turnout groups, and consider whether other offspring or relatives should be sold or bred in that foaling year. Fetal sexing by ultrasonography is based upon identification and location of the genital tubercle. This is traditionally done between about 55 and 70 days, but thanks to the outstanding resolution of modern ultrasounds, the increased depth and field of view that we can achieve with our new transducers, we're now able to extend that window until the uterus is out of reach over the brim of the pelvis. Transabdominal imaging at a later stage can identify male and female genitalia as well as fetal gonads. This presentation will focus on the earlier transrectal window only. The genital tubercle, or GT, is the embryological structure that will eventually become the genitals of the foal. The GT appears as a small, hyperechoic structure during this phase and evolves to a more soft tissue echogenicity as it matures. It forms initially between the hind legs of the fetus, and after 45 to 50 days of gestation, it begins to migrate, reaching its destination by approximately 60 days. In the colt, the GT migrates cranially along the ventral abdomen, coming to rest behind the umbilicus. In the filly, the GT moves caudally and dorsally, ending up underneath the base of the tail. These images show the gross appearance of the structures we're looking for. In the filly, the GT is found under the base of the tail, and in the colt, it's located caudal to the umbilicus on the ventral abdomen. To become skilled at fetal sex determination, you'll need to have a good grasp on probe orientation and image acquisition. It's important to obtain both a negative and positive identification, so be sure to examine both locations. It's a good idea to train your eye first by reviewing as many images as possible. Identifying the structures is the easy part, so you'll want to be confident in that step before complicating things by trying to obtain the perfect diagnostic image in live animals. Most of all, this is a skill that takes a lot of practice, so be patient with yourself. Let's review a couple of ultrasound concepts first. The array is the part of the transducer that produces the ultrasound signal. 128 elements, or crystals, are lined up along the array, each producing sound waves to send out into the tissue and then listening for that returning echo. These individual beams combine to form a thin curtain of sound waves, and the shape and size of that curtain depends on the shape of the array, the operating frequency of the transducer, and the settings being used. If your probe were a kitchen knife, the slices of anatomy you see on the ultrasound image are akin to the cut sections of the oranges that you see here. And then, because we are only able to see one paper-thin slice of tissue at a time, we must learn to move through the third dimension with probe handling, using a combination of these movements to be sure that we have become well-oriented and visualized the extent of the anatomy that we need to see in order to make a diagnosis. These movements are reviewed in more detail in our Ultrasound Basics video, which can be found on our website. Fetal sexing is typically done with the fetus in either a transverse or frontal plane. We want to get as accurate of a plane as possible, so as to not risk overlapping the GT locations with tissues of a similar echogenicity, such as fetal bone from the hind limbs, pelvis, or tail. The umbilicus can be a good landmark. Since it's a stalk comprised of tissue and vessels, it can appear in longitudinal section as alternating rows of black and white or gray as it exits the caudo-ventral abdomen of the fetus. In cross-section, it can look reminiscent of a chocolate chip cookie, a round structure of soft tissue echogenicity with the cross-sections of darker vessels making up the chocolate chips. As a landmark, the umbilicus is wider and less echogenic than an adjacent male GT, and the male GT will be finite in length as you fan your probe away from the fetal body. In this sample image, since we are seeing the fetal body in a transverse plane at the level of the umbilicus, we would not be able to see either possible GT location. As we move our probe caudally along the fetal body, the umbilicus will disappear and we will visualize the ventral abdomen where the male GT would be. Beyond that, when we reach the caudalmost aspect of the fetus, we can examine the area around the base of the tail for the presence of a female GT. Both colts and fillies can be identified in a short or long axis plane. Here's a filly in short axis, where the ultrasound image correlates well with the photo of this gross specimen. The echogenicities of the vertebrae in the base of the tail and the female GT are very similar, with the fetal bone of the hind limbs visible as well. Although it looks a bit similar to the previous example, this image is in a more long-axis frontal view. The female GT is seen within the triangle that's formed by the cross-sections of the tail and the two hind limbs, with the umbilicus to the right on the screen. Conversely, note how when the male fetus is in a long-axis frontal orientation, the GT is positioned forward of the hind limbs, at a distance from the cross-section of the tail. While we aren't able to see the umbilicus in this particular plane, we are still able to identify this as a colt. Here's a colt in a transverse plane. If you can imagine viewing the fetus on the right from behind, peering between his hind limbs at the GT on his ventral abdomen, you can visualize the orientation in the ultrasound image seen here. Fetal sexing is much simpler to do in moving images for context, so let's look at an example of each. Here's a filly in a transverse plane. We identify the umbilicus exiting the fetal abdomen to the right, and as Dr. Bailey fans toward the fetus's hindquarters, a male GT is not identified on the ventral abdomen. At the most caudal aspect of the fetal body, we see a distinct tail head, a female GT, and hind limbs. We then travel back up through the abdomen, past the beating heart, and visualize the head before returning to the area of interest. Here's the nice colt example we looked at a couple slides ago in some still frames. Note the hind limbs, male GT, and umbilicus as we fan forward and back along the ventral abdomen. No female GT is seen. Regardless of the scanning plane, remember to move slowly through all three anatomical dimensions to conduct a full evaluation. Be sure to look caudal to the umbilicus and under the tail to obtain both a positive and a negative identification. If you're unsure and it's a logistical possibility, conduct a recheck exam a day or two later. Sometimes the fetus will reposition itself and you'll be able to get a more diagnostic image. In the beginning, make sure to write down your findings and make note of any abnormalities. Better yet, learn to save video clips on your ultrasound and label them with the mare's identification and your findings. This way, when you do make mistakes, you can come back and review those images. Thank you for participating, and be sure to check out our equine fetal sexing self-test to see how much you've learned.